Hello friends, hope you are doing good. Today we will discuss about the osteology of norma frontalis. As you can see here, the norma frontalis comprises of forehead, pair of orbits, anterior nasal aperture, a pair of malar eminences, upper jaw and lower jaw. So these are the different parts of the norma frontalis, which we will discuss in detail. You can see the forehead. Forehead is a part which belongs to both norma verticalis and norma frontalis, and you can see the pair of orbits, pair of malar prominences, anternasal aperture, that is part of the nasal cavity what you see here, and you will see a upper jaw that is formed by maxillae and hard palate, and a lower jaw which is formed by the mandible. Lower jaw we will discuss in separate session. So here when you see the anterior aspect of the skull, it is having different bones. In the introduction to skull video, we have already discussed about this splanchno-cranium. So norma frontalis is mainly formed by the most of the bones of splanchno-cranium. You already know the splanchno-cranium consists of the 14 bones, out of which 6 are paired, 2 are unpaired. So you can see the different bones here. That is, when you explore the skull in different bones, you can see here what are the different bones you see in the splanchno-cranium. Apart from the frontal bone, you will see a pair of nasal bones there. Each bone is labeled here. You can see the frontal bone, nasal bone, lacrimal bone, zygomatic bone, this inferior nasal concha, palatine bone, and ulnar and mandible. These are unpaired. So what are the paired bones here? You can see nasal bone, maxillary bone, zygomatic bone that you can see here. Pair of nasal, pair of maxilla, pair of zygomatic, as you can see here. And as you rotate the skull here, this disarticulated skull, you can see the lacrimal bones there. I told you in the last class, lacrimal bones are the thinnest bone and they form the medial wall of the orbit. You can see the pair of lacrimal bones. This is a disarticulated skull. Okay, you can imagine the lacrimal bone in the articulated skull where it forms the medial wall. You can see that is pair of nasal bone, pair of maxillae, pair of zygoma, and here you can see pair of lacrimal bones. And as you go inside the nasal cavity, you will see a pair of inferior nasal concha. The lateral wall of the nose has 3 conchae or turbinates, superior and middle and inferior. Inferior concha are independent bones, whereas superior and middle are parts of ethmoid bone, as you can see here. And as you go to the roof of the oral cavity from the basal view here, you can see pair of palatine bone. Pair of palatine bone, they form the hard palate and also form the lateral wall of the nose here, as you can observe. So you can see these all are the paired bones. Once you articulate the skull, you will see like this, the pair of palatine bones articulating anteriorly with the maxilla to form the part of hard palate. So these are the different paired bones forming the splanchno-cranium or facial skeleton. These are the bones which are appreciated in norma frontalis view, and the unpaired bones are ulnar and mandible. You can see ulnar is in the midline forming the part of the nasal septum there, and below the maxilla you are seeing lower jaw, that is mandible. And about the mandible we will discuss separately in another session. So these are the bones, and most of these bones are cartilaginous because they are formed in the cartilage and formed by the pharyngeal arches. And then coming to the different parts, first forehead. Forehead is formed by the, you can see, squamous part of frontal bone and a pair of nasal bones, and you can see the frontal bone is going backwards there, also forming the roof of the orbit. You can see here Once you zoom out here, you will see different sutural points there. Between the two nasal bone, you will see a internasal suture, and between the frontal and nasal bone, you will see frontonasal suture. So where these two sutures intersect, that part is called as nasion. That is nasion. So where the frontonasal suture meets the internasal suture, you can see here, that is frontonasal suture. This is internal suture, T-shaped. Where these two limbs meet, that point is nasion. It is a point of anthropological significance, nasion. And on either side of the nasal bone, the frontal bone is forming a roof of the orbit there. You can see it forms the most of the roof of the orbit. So you can see squamous part of the frontal bone turns backwards at the supraorbital margin as the orbital plate. Then coming to the orbit here, you can see the frontal bone is forming the orbit here. That is the superior wall of the orbit, and you can see that supratrochlear notch, and on either side you can see foramina, supraorbital foramina there. You can see the frontal bone is forming the supraorbital margin. The orbit is in junction with the facial skeleton, forms the orbital margin. As you can note here, that is the lateral margin. Lateral margin is formed by frontal and zygomatic bones. Frontal bone and zygomatic bone meeting at the frontozygomatic suture, that you can appreciate that. Then the infraorbital margin. The infraorbital margin is formed by zygoma and maxillae, that is zygoma, maxillae, and the medial orbital margin is formed by the frontal bone, lacrimal bone, and also maxillae bone. You can see here frontal and maxillae, but there is also contribution from the lacrimal bone. So this is, you can see the lacrimal bone is there, gray colored bone. You can see that lacrimal bone, it is also forming the part of the medial margin of the orbit. So this is about the orbital margin. Orbital margin is the base of the orbit. Orbital cavities are pair of conical shaped cavities. So you have seen there, these are the margins, and these are the malar prominences. Malar prominences are formed by the zygomatic bone. You can see here dark green colored bone, that is zygomatic bone. It presents two processes, that is frontal process and this temporal process, and has three surfaces here. You can see, if you disarticulate a skull here, this is how the zygomatic bone articulates with the three bones here: above frontal bone, below and medially maxilla bone, that is the lateral surface. What you can see, one surface, and here this is orbital surface forming the part of the lateral wall of the orbital cavity. Remember, it forms the lateral margin, also lateral wall, infraorbital margin, and also the floor of the orbit. So here you can see you have seen the two processes, but here it has three surfaces, that is lateral surface, orbital surface, and here it is forming a groove, that is temporal surface. Here it is in relation with the tendon of temporalis muscle of the temporal fossa. So zygomatic bone, when you see, it presents two processes and three surfaces: frontal process, temporal process, and three surfaces are lateral, orbital, and temporal surface, or you can say posterior surface, because it's a part of temporal fossa. We can say it as temporal surface. You can see, so the frontal process articulates with the frontal bone at the frontozygomatic suture, and on the lateral surface you can see a foramina for the branches of the nerve here, zygomatico-facial nerve. You can see there. and here you can see the frontozygomatic suture, frontozygomatic suture, and this is where the zygomatic process of temporal bone and temporal process of zygomatic bone form the zygomatic arch. And if you continue zygomatic arch, it is in line with the superior temporal line, which forms the boundary of temporal fossa containing temporalis muscle, a muscle of mastication. So the upper border of zygomatic arch is F shaped there. Then here you can see it is forming, the orbital surface is forming both lateral wall and floor of the orbit. That is about the zygomatic arch and zygomatic bone. What you see here, remember 2 processes and 3 surfaces. And coming to the anterior nasal aperture, it is pyriform in outline. It is bounded by the nasal bones above. You can see there, if you just disarticulate here, you can see the pair of nasal bones, small nasal bones you can see there, and below and laterally formed by the maxilla bones. You can make out the pyriform shaped outline that is formed by nasal bones, and below and laterally, or laterally and below, by the maxilla, and it supports the septal cartilage of the nose, that is nasal septum. And a median bony projection is called as anterior nasal spine. It supports the septal cartilage of nasal septum. Nasal septum is both cartilaginous and bony. Vomer parts the posterior part of the nasal septum. So you can see here, this is about the anterior nasal aperture. Then you come to upper jaw. Upper jaw is contributed by the pair of the maxillae. Maxilla is a pyramidal shaped bone. It presents 4 processes, and the body contains maxillary sinus and presents 4 surfaces. Here you can see that is vomer and ethmoid bones. So you can see here pair of maxillae on either side of the anterior nasal aperture. You have seen the contribution of the maxillae in the orbit and orbital margins. Here you can see maxilla, as I already told you, pyramidal shaped bone having 4 processes. It contains a sinus, maxillary sinus, very important sinus, and presents 4 surfaces. You can see here the different parts. So maxilla has a greater role in norma frontalis. Remember, 4 surfaces, 4 processes. So first one, what you see here, when you disarticulate here, you can appreciate the maxilla here. You can see the processes more clearly. When you disarticulate it, you can see there, that is zygomatic process, frontal process, that is Pelton process, and here it is, you can see alveolar process. So you can again see frontal process, zygomatic process, alveolar process, and here Pelton process on both sides. You can appreciate the parts of the bone here, and when you see it, here it is having 4 processes. The surfaces, that is orbital surface forming the floor of the orbit. What you see on the face, that is anterior surface having a infraorbital foramina there, transmitting the same named nerve vessels. And as you go behind here, behind and below the zygomatic bone, you can see that is the posterior surface of the body of the maxilla. So you have seen the orbital surface forming the floor of the orbit, the anterior surface forming the facial part, and posterior surface forms the part of the infratemporal fossa. and also pterygopalatine fossa. And as you go medially, it forms the lateral of the nose, that is the nasal surface. It is the base. You can see that is the opening for the maxillary sinus, maxillary hiatus, or hiatus for maxillary sinus, you can see. So here the nasal surface of the maxilla forms the part of the lateral wall of the nose and also has the opening for the maxillary sinus. That is the process: frontal, zygomatic, palatine, and this is alveolar. Alveolar is, that is anterior surface, orbital surface, nasal surface, what you see of the left maxilla bone from the right side. You can see orbital surface, anterior surface, that is frontal process, zygomatic process, alveolar, and palatine process. And as you go posteriorly, frontal, zygomatic, nasal surface, and as you go posteriorly, here you can see the posterior surface with the openings for posterior superior alveolar branches. That is posterior superior alveolar artery is a branch of maxillary artery. It will enter the maxilla from there. Maxillary artery is the content of infratemporal fossa. So remember, posterior surface forms the part of the infratemporal fossa and pterygopalatine fossa. That is about the maxilla. Remember, 4 processes, 4 surfaces, having the maxillary sinus and hiatus for maxillary sinus. You can see the orbital surface, as I told you, it forms the floor of the orbital cavity and also forms the part of the infraorbital margin. Orbital margin is the base, whereas the walls of the orbit are part of the cavity. So here, orbital margin is only involved in this norma frontalis, that is anterior surface, infraorbital foramina, transmitting the same named foramina and same named nerve vessels. In the upper part you have seen supraorbital foramina. Appreciate here again. You can see a thick green colored infranasal concha, that is nasal surface, having this opening. You can see the opening lies above. So that's why many of the people suffer from maxillary sinusitis, because it is draining against the gravity, not natural. You can see that sinusitis is a common evolutionary problem. You can see there, posterior surface, as already told, forms a part of infratemporal fossa and pterygopalatine fossa. So this is about the maxilla bone. There you will see infratemporal fossa. This is a disarticulated skull. You can imagine when you articulate it like this, it lies medial to this ramus of the mandible. So that is about maxilla. And coming to these processes here, you have seen, that is palatine process, horizontal palatine process of maxilla. You can see the zygomatic process joins with the zygomatic bone and forms the malar prominence, whereas the alveolar process, you can see, that is frontal process joining with the lacrimal bone, forms the medial wall of the orbit, zygomatic process, and alveolar process. Alveolar process has a socket for the different tooth there. You can see set of teeth. So the dental formula in adults, it is 2-1-2-3, that is 2 incisors, 1 canine, 2 premolar and 3 molar. As you can see now, you can see the first 2 are, these are incisors on either side of midline, and canine, these 2 are premolars, and 1, 2, 3, these are molars. So dental formula in adults is 2-1-2-3, whereas in children it is 2-1-2, 2 incisors, 1 canine, and 2 milk molars. So this is about the norma frontalis. We will discuss mandible in a separate session. Thank you.